those successes. For instance, child mortality has been halved since the 1990s. Maternal deaths have dropped by over 40% since the year 2000. Over 29 million people now have access to life-saving antiretroviral treatments. Millions are living longer and healthier lives due to cleaner air, better sanitation, and innovative health systems. These gains have not been by accident. They've been the fruits of bold partnerships like Gavi, the Alliance for Vaccination, the Global Fund, PEPFAR, unfortunately that's part of the program that has been cancelled, and the USAID, and many others. But even as we celebrate, we must confront the truth. These gains are now under siege. In 2023, global development assistance declined sharply, and Africa felt the shock. Immediately, maternal health programs halted, vaccine supplies delayed, and medicines disappeared from the clinical shelves. In Ghana, a community-based health delivery model, which we call the CHIPS compound programs, was brought to its knees by abrupt funding withdrawals. The ripple effects were felt all across our country, from Dodowa to Damango. This is not merely a funding gap, it is a crisis of imagination, a vacuum of solidarity, and a deep failure of shared responsibility. Above all, it is a question of the sovereignty, the right of African nations to determine their health priorities, marshal their capacities, and lead with their own vision. And so out of adversity comes opportunity. Africa must no longer be the patient. It must be the driver, it must be the author, it must be the architect and the advocate of its own health destiny. Let us remember that Africa is not new to global health leadership. When HIV and AIDS ravaged our continent, African leaders like President Olusegun Obasanjo and the late Kofi Annan of blessed memory helped catalyze global responses that birthed the Global Fund and Gavi. When Ebola struck West Africa, President Ellen Johnson Sirleaf and her colleagues became a moral compass for the conscience of the continent. During COVID-19, President Cyril Ramaphosa rallied the African Union into collective action on vaccine access. Today, President William Ruto is leading the charge to eliminate malaria as a continental scourge. Today, President Kagame is the African champion on domestic health financing and is leading advocacy in building resilient, self-reliant African health systems. We built and enduring institutions like CDC, Panabios, the African Medicine Agency, that are not merely bureaucracies. These are symbols of an emerging African health ecosystem that is rooted in digital innovation, it is grounded in data, and designed for self-determination by African countries. Your Excellencies, ladies and gentlemen, here in Ghana, we have not stood still. We have uncapped our National Health Insurance Scheme financing, opening a fiscal space of about 3.5 billion cedis more for broader and deeper health coverage. We've launched the Ghana Medical Trust Fund, otherwise called Mahama Cares, a sovereign innovation mobilizing public, private, and philanthropic capital to tackle chronic disease burdens like hypertension, diabetes, and kidney failure. Our launch of our primary health care program in the coming months, along with the recruitment of community health volunteers, will improve the general health and wellness of our citizens, marking a significant step forward in preventive care. And that is where DG Tedros has promised to help us. But let me share one real-life story. And this is of Akosia, a young mother in a town just not too far from Accra, called Dodowa. She survived childbirth complications because the CHIPS compound she attends was digitally linked to a regional hospital. And so in real time, she had a real-time referral system that saved her life in childbirth despite the complication. A digital prescription platform ensured that she received the medicines that she needed without delay. This is not a vision of the future. It is present reality of health sovereignty in Ghana. We're not merely reacting to emergencies, we're building systems that create jobs, reduce inequalities, and uphold the dignity of every Ghanaian, no matter where they are. Health is wealth, and we must reframe the economics of well-being. We must reject the outdated notion that health drains our economies. In truth, health is the engine of productivity and the bedrock of inclusive growth. The WHO has shown that for every $1 invested in health resilience, it yields up to $4 in return. This return is even greater in Africa, where youthful populations represent latent economic dynamism. And so every malaria case that is prevented is a day of work that you have regained. Every maternal death that is avoided is a family that continues to remain stable. Every vaccinated child is a future you have secured for your nation. We must therefore urge our ministers of finance, and I'm sad our Minister of Finance is not here, to treat health as a capital investment, to encourage sovereign wealth funds to allocate resources to biotech, to diagnosis, and resilient infrastructure, to call on economists to revise national accounts to reflect health as productivity multiplier and not a consumption expense. And so I suggest that we act decisively at 3 levels. And the first one is that globally we must champion a new health governance architecture that reflects a multipolar, digitally interconnected, climate challenged world. Health governance must be democratic, it must be just, and it must be fit for the 21st century realities. The second one is that regionally Africa must scale up its homegrown solutions. The Africa CDC, the African Medicine Agency, the African Continental Free Trade Area Health Corridors, and the AUDA NEPA Resilience Agenda. These are all things that we need to scale up. And then nationally, we must execute not merely plans. This requires political will, domestic resource mobilization, and as DG Tedros said, effective leadership. So success is going to depend on our scaling innovations like Panabios for data health verification and pandemic preparedness, Proper for transparent medical supply chains, and BioNova to transform vaccine production from molecules to the market. And what are the new commitments? Today I'm pleased to announce 2 significant commitments. The first is the Presidential High-Level Task Force on Global Health Governance. This will be a convenient platform to engage global and continental partners to redesign the health governance systems for the world we live in now, not the world of yesterday. The second will be the launch of the Sustain Initiative, and this means scaling up sovereign transitions and institutional networks. This is a bold African-led platform that will align our national budgets with our health priorities, will mobilize sovereign, diaspora, and philanthropic capital into our health systems. It will foster cross-border learning, innovation, and accountability. And I extend an open invitation to all nations represented here to join us in building an African health investment ecosystem that is driven by purpose and is powered by equity and anchored in our sovereignty. And so, to conclude, the Accra Declaration for Health Sovereignty that we are discussing in this summit is more than a policy forum. It is a moral call to action. It is a strategic milestone and a continent-wide awakening. And I wish to thank all those who have stood with us in this journey. The Afro Champions, the African Union, the Rockefeller Foundation, the Georgetown University, the Obasanjo Foundation. Your partnership reflects the new multilateralism the world needs, grounded in co-creation, not extraction, and based on mutual respect for each other and not charity. In a world where floods erase borders, and disease do not need passports, we must remember one truth, that in the face of suffering, we are all human. In the face of suffering, titles disappear. There are no doctors, there are no watchmen. What remains is our human dignity. What remains is our solidarity and our shared resolve to protect life. Health is not a luxury. It is the foundation of our freedom. It is the currency of our dignity, and it is our greatest public good. And so let the world hear this from Accra. Africa's pain is not a deficit. It is a death of perspective. Africa's healing is not a plea. It is a rallying cry for sovereignty. Our sovereignty is not isolation, it is co-creation. And so together, what should we do? Let us reset the moral compass of global health. Let us build systems that generate wealth, uphold dignity, and expand purpose. And let us not only reimagine our future, let us own it. And let us make our systems more resilient and self-reliant. And so I thank all of you who have come to join us. And from Accra, we say, let Africa rise and take advantage of the opportunities available. Thank you, and God bless you.
Excellency John Dramani Mahama, the President of Ghana and host of the Africa Health Sovereignty Summit. Please put your hands together one more time. A new health finance architecture, home-grown solutions, effective leadership. The time to act is now, and the place to begin is here. Your Excellency, we hear you. Thank you so much for that clarion call. And we, the people of Africa, will take up the charge. We'd like to thank all our speakers, dignitaries, and partners for setting the tone for the next phase. We are closing the opening ceremony, but we are opening the discussion portal. I'd like to invite upstage Dr. Rabalo to help me, because after the national anthem and the excellencies leave us, we'll be jumping straight into a working session. Fantastic panels to be moderated by this icon of African health and the former Minister for Health for Guinea-Bissau. They want to hear you.
Good morning, Your Excellencies, distinguished leaders, all participants in this very great initiative today. I'm delighted to be back in Ghana. Akwaaba. I was here and I could testify the leadership of the President during the Ebola outbreak when I was at the WHO country office. So as I take over from Bernard, I look forward to your bold initiatives, your bold ideas. We are here to speak frankly, candidly. Nothing is going to be prevented to come from you. We want together to shape the future for global health. Thank you.
Thank you, Dr. Rabalo. So we'll be in their hands right after His Excellency and dignitaries leave us. We'd like to respectfully ask us to rise for the Ghana National Anthem, after which His Excellency and his guests will leave us. Who will remain in this room for the next session, which starts immediately after the leave. Please remain standing. Excellency, the President of Ghana, Excellency Olusegun Obasanjo, former President of Liberia, former President of Mauritius, will leave us. Dr. Hebreyesus will join the delegation, Minister of Health as well. The rest of us will remain in here because the discussions will be happening in the next few moments. We will be leaving you with a few short videos to set the scene. We have some very insightful panels coming up shortly, so please remain in here. There are stands for coffee and cocoa and tea. We will not take an official break, but you can help yourself as the program proceeds. We'll have a 5-minute interregnum so we can reconfigure the stage. We thank all of you for being part of the Africa Health Sovereigntysummit opening ceremony, and I will leave you in the able hands of your own colleague, Dr. Babalo. Video team, thank you.
Yes, sir. Hey, this from which media is So, how to send the these things to you.